name's Cooper Root. I'm a medical student at the University of Kansas. So my project is on posterior cruciate ligament reconstruction with suture tape augmentation. So the posterior cruciate ligament accounts for up to 20% of ligament injuries around the knee, and suture tape augmentation, or STA, for reconstruction is a novel concept. The idea is to increase graft strength and to prevent graft elongation. So the purpose of this study was to conduct a scoping review assessing evidence to either support or oppose the use of PCLR with internal bracing in clinical practice. Suture tape augmentation and internal bracing are kind of synonymous terms, so they may be used in both ways throughout. So a systematic search of three databases was performed following the PRISMA guidelines in April of 2023 to identify any studies looking at PCL reconstruction with suture tape augmentation. We included any surgical technique papers, any biomechanical studies, and any clinical studies as well. Any studies that included revision cases or PCL repair rather than reconstruction were excluded. So I've included two of the figures from our manuscript as well here, kind of just showing the methods of both the clinical studies as well as the biomechanical studies that we found. So 380 articles were identified in the search after removal of duplicates, 6 of which met the inclusion criteria. That would be 3 biomechanical studies, as you can see on the right, 2 clinical studies, and then 1 surgical technique paper. So starting with the biomechanical studies, 2 of those studies showed significant reduction in posterior tibial translation with PCL reconstruction and with suture tape augmentation in multiple studies compared to the control groups, and in which both of those studies, it was the same mechanism of fixation for the PCL ligament, just without the suture tape augmentation. Additionally, suture tape augmentation was found to decrease total elongation by about 45%, which was not statistically significant, and 58% in PCLR groups, differing on tibial fixation of the graft complex. And then increased load to failure was seen with suture tape augmentation as well, compared to PCL reconstruction alone without ST augmentation. For the clinical studies, they showed no significant differences in patient-reported outcomes between the use of PCLR alone and PCLR with suture tape augmentation, except for the Zhao study showed a decrease in visual analog pain scores at rest for the STA group compared to the PCLR alone group, and that was statistically significant. The other study was more of a case series, and it showed significant increases in post-operative IKDC, Ly-Shulman-Tegner activity scores compared to the preoperative scores, along with normal range of motion and return to normal exercise in 93.5% of patients. Additionally, there was no significant difference in complication rate when comparing PCL reconstruction to suture tape augmentation to PCL reconstruction alone. So in conclusion, the biomechanical studies offer evidence showing beneficial load-sharing properties of increased graft strength with decreased graft elongation with suture tape augmentation. And clinical studies showed improved or equivalent outcomes compared to standard PCL reconstruction by itself, with no difference in complication rate. However, the biggest limitations to these studies at this point were small sample sizes, as well as a lack of longer-term data. As you can see, both of the clinical studies were minimum 2-year follow-up. So it's important to get longer-term data to truly understand the benefit of suture tape augmentation of the PCL reconstruction procedure.
All right, thank you so much, Cooper. We do have one question, and that is, what are some of the complications of this procedure?
Yeah, so I'll say the biggest complication of this procedure, and it's more theoretical than anything, would be sort of putting too much stress. They call it stress shielding. So putting too much stress on that suture tape rather than the graft. If you put too much stress on the suture tape itself, it can kind of prevent that graft from getting enough tension to kind of help it develop and kind of form within the knee. So commonly that's avoided by kind of fixating the graft first and tensioning that first, and then extending the knee fully or hyperextending the knee, and then fixating the or I should say tensioning the suture tape, as that prevents kind of that stress shielding aspect that many people are worried about with kind of intra-articular devices. And historically, that's been a problem with a lot of intra-articular devices used for ligament procedures.